Hello everyone, welcome back. It's late in the evening here, Wednesday night, just filing a case for a client. We've been really busy lately, but I wanted to talk to you about not just management act and guardianship, because those are the two main tools that we use to get somebody into treatment, and occasionally the Baker Act when it's used correctly. But somebody had asked me, they said, what do you think is what's the number one factor that you see that causes a family to come to you? Like, what's the underlying issue that's going on? And I said, I think the underlying issue is trauma. Trauma. And they said, well, what do you mean? I said, well, there's sort of various kinds of trauma that we see. It could be emotional trauma, somebody that's been in some type of abusive relationship, and that caused a mental health issue, substance use, those types of things. There could be physical trauma. Perhaps somebody was sexually assaulted. Perhaps they were physically assaulted, somebody who was beaten up. Perhaps they were in a horrendous accident. Perhaps they got in a car accident and got addicted to pain medications, or they fell skiing, or I don't know, some type of accident where they got injured. But sort of and of course, I guess obviously not to forget sexual trauma. We see a lot of that. Yeah, we see a lot of that. That's all I can say. But trauma is the number one. It seems to be the number one thing that we see, the underlying cause. And look, that's not a clinical opinion. I'm just telling you what we see. And I always share what we see here because we see so much. But trauma is the underlying issue here. And like anything else, if it's left untreated, then it can lead to substance use. It can lead to mental illness. And those are the types of things that we see. So I want to share that with you. And if you're a loved one, if you're a family who's got somebody who has experienced some type of trauma, we can help you. And we'd like to help you. And I hope that you'll, pick up the phone and call me and see what we can do to help you. But anyway, sorry for letting out of the video. Been one of those days, but I wanted to share that with you. And have a good rest of the evening. See you in the next video. Bye-bye.